Good afternoon. My name is Alan Koh, Chief Wellness Consultant. And my talk today is on eye cataracts and eye glaucoma and how energy medicine supports our body's self-healing processes against such occurrences, or if they've occurred, how to improve them with energy medicine. Well, look at the eyes, the anatomy. Here's facing the world, here's going to the brain where the optic nerve is concerned. Any part of this can be damaged. If it's a lens that's damaged, the fairly white color one, then the cataract will come about, and it's a different type of vision problem. If this optic nerve is damaged, caused by the intraocular pressure inside here, the pressure keep on pressing against the nerve and damage them, then the transmission of electrical signals to the brain to decipher the image will be compromised, and therefore the vision does not come out very well at all, not sharp at all. Well, let's look at glaucoma first, caused by intraocular pressure. So when the pressure builds up for any reasons inside the eye, the larger part of the eye, it causes irreversible progressive loss of vision due to optic nerve damage caused by the rising pressure within the eye. Who are more at risk of developing glaucoma? It will be the people in the higher age group. Now, this is more talking about the biological age group than literally the chronological age group. If metabolically, biologically, we are younger than our age, then we should not develop eye diseases so quickly. Therefore, to reverse our biological age will be a priority. And by having more oxygen and nutrients going into our body cells and removing the toxins, and also improving blood circulation to those tissues, we can actually reverse our biological or metabolic age. So yes, energy treatment can play a role in reducing these aging processes. How about family members with glaucoma? Well, nothing much we can do. It's the ancestor sperm and egg. There's something wrong in the DNA, and it keeps on passing down. Any treatments in the world will not be repair it. You've got thalassemia, a percentage of the children born will have thalassemia. If you've got sickle cell anemia as another genetic error in our ancestor sperm and egg, then we'll carry it through and we'll pass it through to our children, grandchildren, great-grandchildren, and so forth. However, it's not that family members got glaucoma or any eye disease cannot improve at all using any treatments. They can improve, energy treatment in particular, because these are the natural processes to make sure there's more oxygen and nutrients going to glaucoma cells compared to those people who got just a huge family history of glaucoma. And they're doing a lot of environmental lousy things that cause their glaucoma to get worse. Now, when you look after those areas like lack of oxygen, lack of nutrients, lack of good blood flow, and you improve them, the glaucoma in the family history people would also improve. But they need to do more to improve their glaucoma compared to patients with glaucoma who got no family history of glaucoma at all. Both also can improve. One group needs to do more, and that's the one with family history of glaucoma. How about steroid users? Steroid usage also can cause more glaucoma, especially those chronic asthmatic patients take a lot of Bacotide and other type of hydrocortisone steroid tablets or sprays. And prolonged usage of steroids can actually weaken our eye cells to cause glaucoma. Then some people got eye injury, blunt trauma, penetration. All those can actually cause the glaucoma to develop easier compared to people who never have injury of the eyes, accidents and things like this. Then people with diabetes, where there's not enough blood flow to their eyes, also tend to get into problems with glaucoma. Same as people who got high blood pressure, who got severe nearsightedness problem. What are the types of glaucoma out there? Open angle, which is a chronic type, and closed angle, which is the acute type of onset of ocular pain. 90% of all the cases of glaucoma is the chronic type, whereas 10% will be the acute onset type. If you look at the signs and symptoms of glaucoma, in the early phase, as the disease process keep on growing, we do not know that we got any glaucoma disease developing because there are no symptoms, no signs at all. The vision is still quite the same as before. But as it progressively gets worse, you can see that the peripheral vision is gone. Only the middle of the field of vision you can see. So you don't see the large part of the world, you see a very narrow part of the world somehow. Progressive loss of peripheral, that means the surrounding vision. Quite different from cataract vision problem. So early detection and regular eye check will be quite important if we do want to arrest the disease before there's too much peripheral being compromised, peripheral vision being compromised. So what are the mainstream treatments out there? Usually, they do either surgery or laser or give you medicines to swallow, all of which potentially tend to have complications or side effects. Cataracts is another common disease, also with the aging population. When you look at the eye lens, it's quite cloudy, almost like ghost eyes. Cataract is the clouding of the lens of the eyes. Prevalence of cataracts in Singapore, when we are above 35 years old, about 35% will get cataract. So 35 out of 100 people above 45 will get cataract. And those above 60, 80% would have got some form of cataracts, mild or severe. So severe that they need surgery. What are the causes of cataract? Quite similar to those. That's the risk factors governing glaucoma. Advancing age, again, that's the biological age more so than the chronological age, because some older people are actually healthier than younger people. So it's the biological metabolic age that's the concern. But of course, the tendency in the population is such that the older they are, the older the metabolic age also becomes. But some people can reverse the metabolic age to become younger internally, metabolically speaking. Diabetic people tend to get cataract easier, just like glaucoma, because blood flow to the eye is simply bad to the lens, to the optic nerves, etc. Steroid users, again, just like glaucoma, are the risky people if they use steroids a lot of times. Then trauma, also like the glaucoma. So cataract people, cataract forms easier after eye injury, after eye surgery for other reasons. And congenital means they're born with it. Usually both eyes have these cataracts together. And radiation, all sorts of handphone radiation, exposure to the microwave, looking into the eclipse of the sun without wearing protection, at the eye level, all this can actually bring about more cataract formation. What are the signs and symptoms of cataracts? Early part, again, you do not know until vision starts getting worse. And when it's really worse, you can see it's very blurred. The whole vision is like not focused. And not only not focused, some of the images are distorted, and the image also a bit blurred. But some people get into glare. They even have to wear sunglasses because of that. Well, how does electric energy treatment help? How does it help, rather? Well, it boosts metabolic processes inside the eye cells and inside the blood vessel cells, inside the pancreatic cells against diabetes, as diabetes can bring about cataract formation. So all the eyes, optic nerves, immune cells, all will have more oxygen and nutrients into that once you use electrotherapy to fully charge these cells. So when fully charged, more toxins, harmful chemicals also flushed out, making the eyes and the nerve cells in the area a greater chance to improve significantly. Magnetic field, on the other hand, as a magnetic energy treatment, improve blood circulation to the eyes. Therefore, bring to the area more oxygen and nutrients from the lungs and from the digestive tract to the eyes, to the optic nerves, and draining away more fluid retention, more toxins from the area, out of the area and out of the body, and that will speed up self-repair, self-recovery processes of either glaucoma or cataracts or any eye diseases for that matter. Magnetic field treatment also strengthens each and every immune cell in our body to guard against any germs attacking that weaker area. And so eye infections will be lessened, will be reduced upon magnetic field treatment. 5-infrared is to reduce inflammations. As you apply the 5-infrared in the vicinity of the eyes, inflammation like the redness, the hot part of it, and the swelling and the pain in the area will be reduced. And not only that, more toxins will be cleared away, because this is deep heat to improve blood circulation, and a good blood flow is always a good drainage system to drain away excess fluid and excess toxins. And so vision must improve, no option about it. Thermoxybustion is again 2 treatments in one. Thermos means heat. Moxibustion is the stimulation of the meridian points in the area, the localized area. So combined, more blood clots can be dissolved, more blood vessels will be dilated. The combination will put more blood flow, improve the blood flow to the eyes and optic nerves, therefore transporting more oxygen and nutrients there and taking away the metabolic waste and toxic harmful chemicals that retards repair and recovery processes of glaucoma, cataract, etc. So self-repair becomes more facilitated, accelerated when doing thermoxybustion. Moxibustion, by the way, is the stimulation of qi flow. When the qi flows to the area better, unblocked, then the energy for the repair and recovery processes will be much better, and therefore improvement will be better. So when you combine all the 4 treatments together, it's not possible at all for the medical condition in the area not to improve. It must improve, whether it's cataracts, glaucoma, diabetic retinopathy, AMD, or age-related macular degeneration, all these medical conditions, even inclusive of far-sightedness, energy medicine can play a role. Thank you very much.